just a little bit in English. Welcome to everyone to this new webinar of the digital literacy program, PAHO digital literacy program, coordinated by the Unit of Information Systems and Digital Health. In this opportunity, we will start with a new topic, which is the data management and governance in public health.
Spanish. I am Mirna Marti.
Asesora
I
regional de
am
sistemas de
the regional
información
consultant for
y salud
information
digital
systems and digital health
de la Unidad de Sistemas de Información y Salud
from the
Digital de la
Unit of
UPS
Information
y en
Systems
este
and Digital Health
momento
in PAHO.
envío un especial saludo
And right
de
now I want to send
nuestro jefe de unidad,
special greetings from
Marcelo
our unit
D'Agostino,
chief,
y de
Marcelo
nuestro
D'Agostino,
director del
and our
Departamento
director from the
de Evidencia
Department
e
of
Inteligencia para la Acción en
Evidence and
Salud,
Intelligence for
el doctor Sebastián
Action in
García
Health,
Saizó.
Dr.
Como
Sebastian
ustedes
Garcia
saben,
Saiso. As
esta
you
serie de
guys well know, this
actividades
series of
durante
activities
todo este año se
throughout
centra en
this
cuatro
year we'll
temas
be focusing on
específicos:
four specific
salud,
topics:
inteligencia
telehealth,
artificial,
artificial intelligence,
gestión de datos, gestión y gobernanza de datos, y en
data management and governance,
sistemas de registro civil y estadísticas vitales, porque
and the
fueron los
system
cuatro
of
temas
civil records and vital
más
statistics, because
votados,
these
y
were the
esto es
most
la
important
encuesta
topics,
que
the
se
most
realizó
voted for
hace
the
ya unos meses atrás.
survey
Hoy
that was
nos
conducted a few
toca
months ago.
hablar de
So today
gestión
we
de
have to
datos
talk about
y
data
gestión y
management
gobernanza de datos, y tendremos, bueno,
and data
la
governance,
presentación de lo que hace la
and we'll
OPS por
have
parte
a little bit of
de
what
la
PAHO is
responsable
doing
de estos temas
by the
en
person in charge
nuestra
of these
unidad,
topics in
que
our
es
unit,
Andrea Gerger,
being
especialista en
Andrea
sistemas de
Gerger.
información
Who's a
y gestión
specialist
de
in
datos.
information systems and data
Solo, bueno,
management.
un dato importante:
An
Andrea es la
important
persona
piece
a
of
cargo
information here
de
is that
los
Andrea is the
indicadores
person in
básicos
charge
que
of basic
muchos de
indicators
ustedes conocen
that
y
many of
utilizan
you know
habitualmente
and use normally
en su
in
día a día.
your everyday.
Luego tendremos
Then
a la doctora, dos
we'll
panelistas que van a
have the
compartir con
intervention
nosotros
of
su
two
conocimiento.
panelists who will be sharing
Una
their
es
knowledge with
la
us,
doctora
one of them being
Karin Radix, que es
Dr.
una
Colin Radix,
profesional
who
especialista
is
en
a professional
salud
and
pública,
specialist in
médica,
public health. She is a
líder,
physician. She is
especialía
the
y experta
executive
global en la
leader
región
and
del
global
Caribe, con más
expert
de 20 años
in the
de
region of the Caribbean
experiencia.
with more than 20
Ella,
years of experience.
bueno, desarrolló
So
programas
she
con
developed
énfasis
programs
en
with
sistemas de
emphasis on
información,
information
eh,
systems
principalmente en temas
and
de
mostly
desastres y emergencias,
in topics
en
regarding
las,
disasters and emergencies.
En las pequeñas islas del Caribe. Y bueno,
In the small islands of the
ella
Caribbean,
dirigió
and
la
she also
división
directed
de Human and Social Division en
the
los
Human and Social Division
OECS. También, bueno, lideró una
in
estrategia
OACS,
de más de 11 Estados miembros
and
en
she led a
temas
strategy
de
of more than 11 member states
desarrollo, iniciativas de desarrollo social.
with
Bueno, es una
social development
persona
initiatives.
muy apasionada por la
And she's
transformación
a person who
digital,
has a lot of passion for
por
digital
la
transformation,
equidad en salud a través de
healthcare
la
equity as
educación,
well, via education
los programas basados en evidencia
and
y la
evidence-based
colaboración.
programs
Ella en
and
este
collaboration.
momento es decana asistente
Right now, she's an
en
assistant dean
salud global y comunitaria de la
in global and
Universidad
community
de
health
Ross,
from the
y
University of
bueno,
Ross.
ella continúa siempre
And
educando,
she's continuously
formándose, ¿no?
providing,
Formando
she's constantly
profesionales
training herself and
especialmente.
training professionals as well.
Y después nos acompañará
And then
la doctora María
with us, we're going to have
Yuri
Dr.
Travasos y
Maria
Chijara,
Yuri
que es doctora en
Travassos
salud
Ishikara.
pública y
She is
profesora
a doctor in
colaboradora del
public health
programa de
and a
posgrado
professor
e
collaborating in the
investigadora y
postgraduate
colaboradora
program and a
de la
researcher
Fiocruz,
collaborating for Fiocruz, which manages, of course, a large volume of data in Brazil for the evaluation of social determinants and the impact of public policies and health. She participates as a researcher in several projects, and it's particularly important to highlight a project that has a cohort of 100 million Brazilians for the analysis of social determinants and public policies in the health of Brazilian populations, particularly maternal and infantile health and mortality. She was also participating in studies about social determinants and supporting the programs of platform of aggregated data with the purpose to capture demographic data as well, and has knowledge of governmental information, particularly for issues of data purging, for research, and the area of data privacy as well. She has an expertise in the elaboration and execution of projects with international partners, such as the London School of Indian Tropical Medicine, the Glasgow University, and Bill and Melinda Gates Foundation, and many other organizations. So I am now going to hand it over to my colleague, Andrea Gerger, who is going to give us a summary of what the organization is doing in terms of data management and governance. Go ahead, Andrea.
Gracias, Mirna. Bueno, visión y acción en
Okay,
gestión
vision and
de
action
datos
of data
en
management
OPS.
in
Voy
PAHO.
a hablar en español.
I will
Mi
be
nombre es
speaking
Andrea Gaga
Spanish.
y
I
tengo el
am
gusto
Andrea
de
Gaga,
hacer la presentación
and I'm
sobre
happy
el
to
trabajo en
show the
gestión de datos
presentation
en la
about the work in data
organización en el
management
marco de la
in the organization
alfabetización
on
digital.
the framework of
Voy a
digital
abordar un poco la
literacy.
importancia del
I'm going to
dato
address a
en la
little bit of
gestión
the
de
importance
datos y
of
también
data, data
lo que estamos
management,
haciendo en la
and what we
OPS.
are doing in PAHO about it.
La OPS tiene una larga trayectoria
PAHO has
como
a long
institución de
history
salud
as an
pública
institution
digital
for
encargada de
public health,
monitorear la
which is
salud
in
de
charge of
la
monitoring
población. Fiebre
population health.
amarilla, malaria,
Yellow fever,
tuberculosis
malaria,
fueron las
TB.
primeras
These
enfermedades que
were the first
justificaron la
diseases
creación del
that
OPS para
justified the
coordinar los
creating of
esfuerzos
PAHO to be able to
transfronterizos.
transform the
Entonces, y la OPS
trans-border
en la
efforts.
Constitución de la OMS
And PAHO
estipula
and
que cada Estado
the
miembro
Constitution of
debe de
WHO
informar
states that
los datos
every
a la
member state
organización
needs to report
y
this information to the
de las
organization,
funciones esenciales de la
and the
salud
essential
pública. La
functions of
condición
public
esencial
health,
número 1 dice
number
que los
one,
datos que se
say
colectan son
that
necesarios para
the data
entender
that
la salud de la
that is being
población
collected
y
is
establecer
necessary to be able to
las
monitor
políticas
population
y hacer
health,
evaluaciones
to
de
look into the
intervención.
policies and for
En
intervention
este
assessments.
sentido, la OPS
To that
colecta,
sense,
analiza y
PAHO
comparte
gathers,
datos, sobre
analyzes,
todo
and
los
shares
datos
data,
para poder
particularly
monitorear
data
los
used to
mandatos que nos han
monitor
dado
the
los Estados
mandates
miembros.
that have been given
También
to us
los
by the member
datos
states.
promueven
Also,
la contabilidad, la
data encourages
transparencia y más
accountability
eficacia en
and
la organización,
transparency in
guiar la
our
alocación de los
organization.
recursos
It also
y
guides the
promover la
allocation of
cooperación
resources
regional.
and
Comparar
encourages regional
permite que los
cooperation.
países
The
comparen y
comparison
aprendan
allows
uno del otro
countries to
en
compare
sistemas
and
de
learn from one
información.
another in terms of
A la
information
izquierda ustedes
systems.
pueden ver algunos ejemplos de
On the
iniciativas de
left,
datos
you'll be
que
able to
manejamos en la
see some examples
organización.
of data initiatives that
Y
we
quiero
manage in the
enfatizar que
information.
atrás de
And I want
cada
to
una de estas
emphasize that
iniciativas,
behind each of these
quiero
initiatives,
destacar indicadores básicos,
we have basic
enfermedades
indicators
transmisibles,
of
enfermedades
communicable
no
diseases,
transmisibles, la
non-communicable
iniciativa de
diseases,
eliminación de
and
datos
the
de
initiative
enfermedades.
of data
OPS tiene un inmenso
in terms
esfuerzo
of
de
diseases and the
coordinación de datos
debugging
atrás.
of data. This requires an effort of data
Ahora,
coordination.
hoy día la transformación digital
Now, digital transformation
nos ofrece
today
varias oportunidades en la gestión de datos.
provides us
Por
several
ejemplo, según la
opportunities in terms
OMS,
of data
las
management.
intervenciones
For
digitales
instance,
en
according
gestión de
to the
datos nos
WHO,
ofrece desde la colección de
data
datos, que
management
puede ser a
offers
través
us
de
data collection,
plataformas, a
which can be
través de
done through
aplicaciones,
platforms and
hasta el
applications,
almacenamiento de
all the
datos,
way
las
down to
visualizaciones a
data
través de
storage,
business intelligence
visualization via
la
business intelligence,
automatización Todo
to the
este proceso
automation.
se facilita
All these
con la
processes
transformación
are
digital
enabled
hoy día
via digital
y nos
transformation
promete que
today.
podemos tener datos más
And it
accesibles,
promises
datos más
to provide
confiables,
us with
tenemos
more
datos más
accessible and
oportunos,
reliable
podemos
data,
automatizar
timely
los
data.
procesos,
We can also
incluyendo la
automate processes,
automatización de la
including the
validación de los
automation of
datos,
data
la
validation,
interoperabilidad.
the
Pero
interoperability
también
of this
sabemos que
data
no
as well.
existe una
But we also
coordinación y
know that if there
planificación de los
isn't
procesos de
coordination and
datos,
planning
igual
and the
vamos a tener
processing of
un
data,
aumento de volúmenes
we're
de
also
datos
going to have an
que quizás
increase
no
in
se
the volume
usan.
of data
Vamos a
that
poder
are,
tener
maybe are
datos
not used.
incompletos porque solicitamos
We're going to have
demasiada
incomplete
información
data
y ahora
because
es
we are
más
requesting a
fácil
lot
de
of information
obtener los datos.
because it is now
Vamos a
easier
tener
to obtain
roles
data.
sin,
We're going to have
vamos a
roles
tener roles y
and
responsabilidades ambiguos.
responsibilities that are going
Los
to
propiedad de
seem
los
to be
datos va a
ambiguous.
seguir
The ownership of
sin
data
definición.
will continue
Podemos tener
and
datos, pero no tenemos
non-defined.
el contexto de los datos
We
y no
may
vamos a
have
poder
data, but not
interpretar los
having
datos.
the context, and
Igual
we were
vamos a
not going to
poder tener
be able
sistemas de
to
información digitales
have
que no
very good
necesariamente hablan
systems
entre sí y
that
no podemos
are necessarily
intercambiar
speaking to one
información.
another, and then we won't be
Entonces,
able to exchange
muy
information.
importante que nos
So,
dedicamos
in
a la
other words, it's
gestión
very
y la
important for us
gobernanza
to
de
be able to
datos.
work with data management
¿Qué
and
ha hecho entonces
governance.
la OPS
What has
para
PAHO done then
institucionalizar
to
la
be able
gestión y la
to
gobernanza de datos?
standardize data management
Empezamos
and
antes
governance?
de la pandemia 2020
So, prior
y
to the
con,
2020
con, con
pandemic,
una encuesta
we
de
started
la
with
situación de
a
salud de
survey
nuestros sistemas en la
on the situation of
organización y
healthcare
también el
of
nivel
our
de
systems in
madurez que
our
hemos
organization and
analizado
also to
y quiero
measure
nomás
the level of
destacar
maturity.
algunos hitos.
And
Y
so I want to
se
highlight some
creó un comité
milestones
de gobernanza,
in
un
regards to
comité
that. We created a
estratégico
governance
para guiar la
committee, a
formulación
strategic committee to be
el
able to
camino
guide
que
the
queremos
formulation of
tomar.
the policy and
Otro
the
gran
pathway
logro
we
era
wanted to
la
take.
formulación de una
Another great
política de
achievement was the
datos que
formulating
estipula las
of
reglas de
data
manejo de
policies
datos
that
en la
establish
casa.
the
Y
rules
otro
of
hito
the
es el
in-house
datatón, que es un
data management.
ejercicio
The other
para fomentar
milestone
la
was a
cultura
datathon,
de
which was an
información y
exercise
también
to be able to
pensar en
manage
una
information
arquitectura de
culture and
información
thinking about an information
renovada,
architecture
revisada,
that will
que
be
voy a
renewed,
explicar
revised,
posteriormente.
and that I will explain later on.
Aquí, por supuesto, nuestro
Here, of
marco de
course,
gobernanza y
our
gestión de
governance
datos.
framework
A
and
la derecha, la
data
definición. Para
management. On the
nosotros,
right, we can
la
see the
gobernanza de
definition
datos
of what
es
data
el
governance is all about,
proceso
which is the
de las
process
decisiones sobre datos
for making
y eso
decisions
incluye, por
based on
ejemplo,
data.
definir
And
los
here
roles
we
y
include, for instance, the
responsabilidades, dónde
definition of
vamos a
roles and
invertir,
responsibilities.
tenemos
Where are
recursos
we
de
going
base,
to
tenemos
invest?
recursos
We have
financieros,
human
tenemos una
resources, we have
política,
financial
cuáles son los
resources,
estándares.
we
Y
have
la
a
gestión de datos,
policy,
que
what are
son
the
todos los
standards, and then
aspectos
data
a
management, which
largo del
are
ciclo de
all of
vida de
the
los datos,
elements
desde la
that accompany
colección hasta
data life cycle
la
from the very collection
diseminación o la
to
retención y el
the
desecho de los datos.
dissemination
Bien
or the
sabiendo
retention
que en gestión
or
de datos
the disposal of this
el
data.
proceso no termina
The
con tener un
process,
dashboard.
though,
Hay que ir
it's
allá
not
desde los
just
datos hasta
ending
la
with
acción.
a dashboard. We have
Pero
to
aquí
have
hablamos
from
la
the
gestión.
very beginning of the data to
Aquí
all the
quisiera
end of
mostrar
its management.
solamente el esquema de nuestra
And here I
política
want to
de
show the
gestión
layout of
y
our
gobernanza
policy
de
of
datos
data
que
governance and
tiene un
management,
propósito,
which
que
has
tiene
a
un
purpose
objetivo, que tiene
and
los principios
an
rectores.
objective established
Aquí
with
quiero
guiding
hablar
principles.
brevemente del uso
And I
ético y de la
surely
protección
want
de
to talk
datos, que
about the
es muy
ethical
importante,
use and data protection,
que
which is very
necesitamos
important, something we
balancear el
need
uso
to
del uso
consider in the
correcto de los
balancing
datos
of
y la protección, pero también el
use of data
uso,
and protection,
la calidad de datos, la
data quality,
interoperabilidad,
interoperability of this data
promover el
to
acceso a los datos
encourage
y
open
valor de los
data
datos no
and
estructurados.
the
Entonces, muy
value of
importante definir
unstructured
en la
data. So it's
organización
very
cuáles
important to
son
have a
nuestros
clear definition
principios
in our
rectores
organization
y las
what are our guiding
responsabilidades.
principles and the
Tenemos un
responsibilities.
comité, el
So
comité
we have
de
a
alto
committee,
nivel, tenemos
a
un
high-level committee.
secretariado técnico y
We have a
también los
technical
roles de cada
secretary,
entidad en
technical
la
secretariat, and also
producción
all the
de
roles
datos.
in the production of data as well.
Um, un tema muy importante
A
es
very
los
important topic
roles,
here has to do
los
with
roles y
roles and
responsabilidades.
responsibilities.
Nosotros hemos definido
We
los
have
cuatro roles,
defined
los más
the
básicos,
four
basado en nuestra
most
realidad de trabajo
basic
con
roles
datos
based on our
y también
reality
basado en
of working with
estándares
data and
internacionales.
also based
Entonces,
on
cada
international
equipo que
standards.
trabaja con datos,
So
cada
every
entidad debe de tener
team,
por lo
every
menos
entity working
un
with
data
data
owner,
needs to have at least
el
one data
dueño de los
owner,
datos, que es el dueño que tiene la
And that's the
supervisión de
one that
todos los
has the
procesos,
supervision of all the processes,
que es el contable de los procesos.
from
Entonces también
being the person
el equipo
accountable
debe
for the
tener un
processes.
data
So the
steward,
team
que es
needs
el
to have
responsable
a data
técnico,
steward
que
who is
define
a
las
technical,
reglas, lo que
responsible person who defines
lo
the
que se
rules
recolecta, la
and what's being
interpretación,
collected, the
los metadatos,
interpretation, the
lo que significan los
metadata,
datos.
what that
Y el data
data
steward debe estar
means. And
apoyado por
the
un
data
custodio
steward
de
needs to have
datos,
the
que
support
es la
from a
autoridad
data
desde la
custodian,
perspectiva
which
del
is that
tecnología de
authority from the
información,
IT
que
perspective,
apoya en tener el
giving
almacenamiento de los
support in the
datos, el
storage of that data,
mantenimiento
the
de
maintenance of
la
that
captura de
data,
los datos, la
the
validación
capturing the
y
data,
también
the
la
validation,
automatización. Y
and the
siempre hay que
automation.
tener incluido
And
en
we
el
always
equipo
need to
el
have in that
experto del
team
tema
our subject matter
que
expert.
necesita ser informado y
That person needs
consultado.
to be
Entonces
informed
es muy importante que
and
se
inquired
reconozca
about.
y que se
So it's
tengan
very
sus
important to
roles para tener
recognize and have
procesos
these roles
sostenibles.
clearly established for sustainable processes.
Otro tema muy importante
Another
es el
very
tema de la
important
calidad de
topic
los
has to
datos.
do with data quality.
Nosotros definimos la calidad de
We
datos,
define data
que es el
quality
grado en que ciertas
as the
características
degree under
cumplen
which
y nuestros
certain characteristics
características de
fulfill
calidad
our
es la
criteria. This is
completitud,
quality
la
criteria,
confiabilidad,
which
la
is the
coherencia con
fullness,
el tiempo, con otros
coherence
indicadores
in
y
time with other
con áreas
indicators,
geográficas, la
along with
oportunidad
geographic
y la
areas, the
interpretabilidad.
timelines, and the
Y quiero
interpretability
hacer
of this
énfasis
data.
que es muy
And I want to
importante
emphasize
contar,
here that it's very
no
important
subestimar la interpretabilidad de los
to not
datos, saber de dónde
underestimate
viene el
data
dato, la fuente,
interpretability,
el
to know where
proveedor,
the data
para
comes,
poder
the
interpretar el
source, the
dato,
provider, to be able to
a
interpretate
pesar
that
quizás
data,
el dato no tiene una
even when
completitud
that
alta.
data may not have a completude itself.
Y por último, el
And then
datathon.
lastly,
Nosotros en
the
la OBS
datathon.
estamos organizando en
In
países,
PAHO,
pero también
we are
en nuestra
organizing
propia
this in
organización,
countries, but also
este
in our own
ejercicio
organization. We're
de
putting together this
surgimiento de datos.
exercise
Es un ejercicio con
of
el
data
Sistema Nacional de
discovery. It
Información
is
de
an
un país o
exercise
de
that
una
is being held
organización,
with
y
the
que todos
information system of an
trabajan
organization
con
and a
datos,
country. So
que son
everybody
los
working with
usuarios.
data,
Entonces, los
they become
temas
the
que se
users.
discuten es
So
el
these are the
descubrimiento de
topics, the
datos,
themes being discussed
el
about:
flujo de los
data
datos, cómo
discovery,
se usan
data
los datos
flow,
y
how
también
is data
discutir las
being
buenas
used,
prácticas
and
en la
also to be able
gestión
to
de los
discuss
datos.
the best
Entonces,
practices in data management.
como dice, la mecánica, dinámica es
So
muy
the
interesante
dynamic
porque
is very
en
interesting
versus de la transformación digital, ese ejercicio
because
es todo en
in
papel.
seeking
Entonces, como
digital
ven las fotos,
transformation,
los
this
colegas
exercise is
vienen
all
y
done in paper. So
dibujan
as you see
las
the pictures,
bases, las
our colleagues
variables y
come,
luego
they
dibujan las
draft the
conexiones,
basics, the
cuáles datos
variables, and the connections,
tienen
which
problemas de
data
calidad, cuáles necesitan
shows
ser
quality
conectados, dónde
issues,
hay una
which one
brecha
needs to be
dónde hay
connected, where do we
redundancias
find
de
a gap,
datos.
where do we
Y
find
como
data
resultado en la
redundance.
OPS
And
de
as a
este
result,
ejercicio, tuvimos
in
un
PAHO,
primer catálogo de
we
datos
had a
y
first
también se
data
decidió de
catalog,
hacer
and we
una
also
capacitación para
decided
todo el personal
to
de
conduct
diferentes niveles
training
en la
for the
gestión
whole
de
staff in
datos.
various levels for data management.
Quiero destacar Ecuador, donde se ha hecho el primer datathon y también enseguida
And I
por
want to
Belice
highlight Ecuador,
y
followed
Surinam.
closely by Belize and Suriname.
Resumiendo las áreas
So to
que estamos
summarize
trabajando
the
en el
areas
de
that we're
datos, bueno,
working with
en
in data
assessment, el
management,
diagnóstico, en el
in the
el
assessment,
sistema de
diagnosis,
información
and the
para la salud,
diagnosis of information systems for
am,
health,
en el establecimiento del comité,
in
en
the
la política, que es un
establishing of a
documento vivo
committee,
que
the
está
policy, which is a
mejorándose y en
living
el que nunca
document that is
estamos
constantly being
aprendiendo. Estamos
improved. We keep
desarrollando
learning
los,
on the go.
los
We are
estándares o
developing the
seguimientos personales
standards
estándares de
or
los diferentes
personal
temas,
standards
por
for
ejemplo,
each
calidad de
topic.
datos,
For
cómo
instance,
discutir
data
metadatos,
quality,
cómo
how to
revisar
describe
datos, cómo referenciar
metadata,
datos, cómo
how to create
guardar
reference of that
datos. Y
data,
también
and how
de
to
los
store that
roles y
data. Also, we're
responsabilidades.
learning from
El
the error,
catálogo
the
de datos,
roles
ya
and
mencioné, el
responsibilities.
curso de gestión de
As I said,
datos,
the
el
data
datathon,
catalog that I
y
mentioned,
como el motor de
the
innovación de
datathon
fomentar la
as a
cultura de
model
la
of innovation
información,
to be able to
y también
encourage
la comunidad de
information systems
práctica
culture, and
en la
also the community
alfabetización
practice
digital,
for
que
digital
vamos a hacer
literacy.
una red de expertos y
That we're going to
colegas
create a network of
en temas
experts and colleagues
seleccionados.
in selected
Con esto
topics.
quisiera ya hacer
And with
las
that,
conclusiones
I'm
finales de la
giving
OBS
the
sobre gestión de
closing to my
datos.
topic
Entonces,
in terms of
acordamos que
data
los
management for
datos es
PAHO.
un bien estratégico.
We remember that data is a strategic
Am,
good.
muy importante tener una gobernanza y gestión sólida,
very important to keep having a solid and constant training with standards, ensure integrity, quality, and safety and the life cycle of data. To find digital transformation as an opportunity, but also looking into the challenges that may be coming about on the road. So we can't transfer what we have in a paper into digital just cause. We need to think about what the processes will require. Important to also think about a change in the institutional culture to strengthen capabilities, to encourage collaboration, and the responsible use of data that is considered in digital transformation with initiatives such as the Datathon and all the results of that learning pathway. There's a shared commitment that tells us that we can work together to strengthen data systems to create equity, transparency, and accountability to be able to support the achievement of optimal health for everybody in the Americas. Thank you. And so with that, I want to thank you for your attention, and I finish my presentation with that. Thank you very much, Andrea. And now we're going to move quickly to
Dr. Carlin Radix to share with us her presentation.
Yes,
we can.
Okay, wonderful. It was really a pleasure to be here and to be amongst this esteemed panel talking about health data management and governance. Andrea went through the good work that PAHO is doing throughout the region relating to data management and governance. And I hope to just take you through a more high-level overview of data management and governance, maybe a way to think about data management and governance from whatever place you sit, whether you're sitting in a place that's dealing with data management or governance, or you sit in another part of the health system. Certainly, you might have a better understanding and inspiration, because really, health data management and governance is about improving health outcomes by ensuring secure and efficient health information use. So at the end of the day, we want to be able to improve our health outcomes. So what is data management and governance? What are some of the things that we think about? And Andrea went through many of these in her presentation. We're talking about a system for handling data, right? Management and governance, and the whole data cycle, which includes collection, storage, transformation, and most importantly, utilization of that information. And we'll go a bit more into these. There's also a role in policy making and resource allocation, because all of these parts of the system take both human and financial and infrastructure and other resources that are needed at the national level and at the institutional level. Of course, data accuracy and timeliness is important, ensuring that the information that's needed for an appropriate public health response and for an improved health outcome is there. And any good data management and governance system fosters transparency and trust, not just amongst healthcare providers or public health professionals, but also amongst policymakers and general citizens. So as we are creating information from data, there needs to be trust. So what are some key principles we're thinking of when we think about data management and governance? I think too much of the time we go straight to security. We are very concerned, as we should be, about the security of data. But I want you to think about security for a moment. Let's say, think about the security in your home, ensuring that your home is extremely secure. You wouldn't want to have a security system that locked you out of your own home, or made it very difficult. Maybe you had to try 10 times for you to get through your front door, or made it difficult for you to go from your bedroom to your bathroom, for example, right? Privacy, again, is important. You'd want to know that you could, close your blinds or not necessarily have persons looking in. But if you wanted to look out, you would want to know that the blinds could be opened or that a window could be opened for access. And I use this kind of metaphor because the same is true with data. Data confidentiality and data security are important, but just as or even more important is the accessibility and utilization of the data. So data does not just exist as ones and zeros or numbers or pieces of information without access for it to be collected, for it to be transformed, and for it to be used to inform decisions and improve outcomes. And so it's very important that in data management and governance frameworks and policies, that there's a balance between protection and use of data. So talking a little bit more about the health data life cycle, I think many of you may have seen this kind of a pyramid. We talk about data, data that's collected, random database data all around us. I don't know how many of you would have looked at the Matrix movie. I'm dating myself. Often along the screen, there were lots of zeros and ones passing by, and this is like the data, right? It doesn't make any sense. But somehow all of that translated into the matrix, some sort of knowledge, some sort of information rather. And even beyond that, there was the oracle for whom from all of this information, there could be more knowledge. And maybe Neo was a source of wisdom. But for those of you who don't look at the matrix, just remember that data, pieces of data, until it's transformed, are not that useful, right? If we think about random letters listed on a page, when we transform those letters into words, they bring more information. And when those words become sentences, and those sentences become paragraphs and works of art and books of knowledge and wisdom, that is how we transfer data. So looking here, obviously, there are many ways we collect data in health, that we collect a lot of vital information, and we produce data in all of our health systems continuously, in our clinics, in our public health departments, in our hospitals, in our environmental services. There are pieces of information being gathered in books or computers, databases, immunization registries, surveys, etc., that need to be transformed to information. So data collection is an important part of governance. How do we collect the data? Who has access to put data in? How do we ensure the data is quality data? Where do we store the data? So data storage and security and backup. Being from the Caribbean, we understand the impacts of extreme weather and of potential risks for earthquakes, volcanic eruptions, etc. How do we store? How do we transform? And again, we can get into the details. We've got the data specialists here, but really, how do we make that data information and knowledge for effective use? And then when we know the information, do we use it? Is it getting to the right people? Are the right people who need to make the decisions seeing the information in real time, interpreting the information correctly, and using it to improve health outcomes? It would be remiss of me to have this talk without something on AI, artificial intelligence, as it begins to permeate our every being. AI enables some of that transformation of data automatically, right? And there's a double-edged sword. So again, it's important to know where AI is pulling that data from that is about to transform. So it can definitely improve data quality and clinical decision making, but there's questions around that transparency and that accountability. We talked about the confidence of where the data is coming from. And because AI has the ability to pull data from wide resources unless controlled, this becomes an issue. Related to that are issues around data privacy and regulation. And in general, I mean, we're being exposed to all of these different AI tools. It's very important that as we build resources, we build the human resource ability to appropriately use AI tools for the best outcomes in data. So I want to take a moment to talk about the case of COVID, because this really changed a lot of our minds and a lot of our processes around data. So I have a quick question for you. I'm hoping that you're able to join at menti.com or use the QR code and just answer this question. How did data management and governance improve in your country or in your space during the pandemic, right? How did data management or governance improve? And it can be you can talk about something as small as an improved security or improved accessibility or improved sharing or information, anything within your space. Okay, wonderful. I'm going to actually stop sharing so you can begin to see your answers coming up on Mentimeter here. Just give me a second. So a lot of what's talking about here, timeliness. There was a pressure to provide numbers, which may have affected quality, right? Improve sharing, use, and efficiency. Analysis. So there was a lot of improvement in terms of data use, utilization, sharing, governance, access. And I think for a lot of things, things that we didn't think were possible became possible and emphasized during that time. All right, let me see if I can go to the next question here. All right, so the next question I have for you, what were the challenges, right? So after you've answered the first one, what were some of the challenges that we had with data? So again, some timeliness related to new technology, PCR results, or insufficient teams, difficulties capturing data, safety, poor definitions, not having data in real time, no standards, obsolete, dirty data. Yep. So when you do it quick, it's often dirty, quick and dirty. Not having technology, and again, difficulty in human capacity. Lots of paper-based data convert. So if you had paper-based systems, there was the pressure to now transform that information. Yeah. The change, the pace, the time, you had to adapt continuously going through the process. We said this today and tomorrow, definitions changed. Yes, the infodemia, there was lots of false information out there that you then had to be able to assess. All right, so I'm going to resistance to change, security. Thank you so much. So I'm going to stop here. Misinformation having more spotlight than official communication. And reshare my presentation. So let's talk a bit about governance frameworks. We know that there are needs for continuously updated policies and frameworks at the national level with clear roles and responsibilities. Andrea spoke to these, and that there are key stakeholders, including healthcare providers, the private sector, civil society, and we saw how there was need to transfer information between these sectors during the pandemic. There are different roles. Remember that governments regulate and help ensure that policies are followed, while often private sector innovates. I would argue that PAHO also innovates to ensure that we have better technology, better ability to use, store, collect the data. And then we must advocate for the ethical use data, ensuring privacy, confidentiality, that we give credit, etc., where data is concerned. But I think one of the things that was highlighted in your answers was the collaboration among stakeholders and how important that was during that time. Allow me to take a moment to talk about small island states, we coming from the Caribbean, and some of the challenges with health data. With small population sizes, often limited data granularity, or small numbers, or interpretation, there can be some challenges. The usual resource constraints and vulnerabilities. I talked about climate, vulnerable economies. So issues of resources, technology, and infrastructure and funding impact data governance. Collaborative solutions are key. Regional collaboration and shared platforms really help. PAHO has shared information platforms across the region, and collaborative solutions through collaborative agencies such as the Caribbean Public Health Agency are really assist. And it's important that all of these strategies we talk about are customized to the local context. And that's not just at a national level, it's at an institutional level, it's at a level of the people who are interacting with data at that level. So what are some of the strategies for improvement? Capacity building initiatives. We need more trained personnel in various areas, and this initiative through PAHO is one of the ways that we're doing this. Regional collaboration, sharing resources and expertise, clear policy frameworks with consistency and accountability, and for many countries, the international support role, funding, technical assistance, and advocacy to strengthen health data systems are important. So I want to end with a call to action for all of you. I hope you've been thinking about the importance of data and the fact that data is really information to improve our health systems. And so data governance and management are key to enable better health outcomes. We must collaborate, and I know collaboration is always difficult. We've got to pull people together from different sides. We've got to do a lot to get the information to put it together, but the impact is undeniable. And finally, we must ensure that we build resilient systems, especially in economies and countries where there are resource constraint settings and geopolitical changes, that there is that your systems can endure. And with that, I thank you very much for your attention.
Muchas gracias, Carly, por tu excelente presentación.
Thank you very
Vamos a
much, Carly,
pasar
for your excellent presentation. And we're now real quick going to move to our next panelist. And before that, I got to tell you that we have to move a little bit further our time because we had some technical issues. And so we're going to take a little bit longer with our session. So we really thank you so very much for your patience, for being with us a few more minutes. And so with that, I want to hand it over to Maria Yuri.
So Eu vou falar em português. Eu gostaria de agradecer primeiramente o convite feito para
First of
fazer
all, I
essa
would like to thank you
apresentação,
for the
que é a
invitation for
governança
this
de dados de política
presentation
e saúde
on
pública,
data
que é a
governance
experiência do
for
SIDAX. O
research in
SIDAX, ele
public
é um centro de
health,
agregação de dados e conhecimentos para a
which
saúde.
is the case
Foi
of
um
SIDAX,
centro
which is the Center
criado em
for
dezembro
Data
de
Integration
2016,
and
a gente
Knowledge
tem
for
8
Health,
anos, trabalhamos
which
com
was
dados
created back in
populacionais para
December
pesquisa em
2016
saúde e
for
somos
8
uma
years
unidade vinculada à
for health
Fiocruz
requirements, and
Bahia.
we are in unit
Produzimos
that has to
conhecimentos
do
para
with
informar políticas
the Via Cruz
através de
from Bahia.
pesquisas
We produce knowledge
interdisciplinares e
for the
trabalhando com
reporting of
equipe
policies via
multidisciplinar,
multidisciplinary and
usando
interdisciplinary research with a
metodologias
multidisciplinary
analíticas e
team
criando
using analytic
capacidades no uso
methodologies,
dessas grandes
creating
bases de dados
capabilities in the
nacionais
use
públicas
of that
vinculadas e
big national
utilizando
and
recursos
public
computacionais de alto
database
desempenho,
and
segundo
using
todo o nosso processo de
computer resources
governança,
of
que
high performance,
os marcos que são os
following
marcos
all our
regulatórios
governance processes,
éticos de
which are
segurança e
the ethical and
privacidade de dados.
regulatory
Quem
frameworks of
quiser conhecer mais sobre o
data
SIDAX, está
security and
publicado
privacy. And
nessa
I want to learn more
publicação
about
International
SIDAX.
Journal
And if you do,
of Data Science.
it is published in
Então, no Brasil,
this
acho que
data
todos
science
conhecem um
paper.
pouco,
In
nós
Brazil,
temos um
and
amplo
I
ecossistema
think
de
everybody
dados,
knows that a little
né,
bit, we have a
nacionais
wide
que
data ecosystem
podemos utilizar, né, para trabalhar com pesquisa,
that
trabalhar
we
com
can use to be
monitoramento.
able to
Normalmente, esses
work
dados administrativos eles
with
são
the
coletados,
research and
armazenados e
monitoring.
publicizados pelos
Normally,
vários governos, né, setores do
data
governo,
is
para
stored and
subsidiar essas
publicized by
atividades
several sectors of
administrativas
the
e os
governance.
serviços de auditoria. E nós temos um ecossistema
To talk
enorme.
about
Nós
these
temos
services, the
ecossistema de
auditing
políticas
services, and
sociais,
this
nós
is a
temos ecossistema
huge
de saúde, nós
ecosystem,
temos o censo,
a social
temos
policies
em cada
ecosystem, and
ministério nós
we have
temos
in healthcare, we have the
sistemas nacionais
census.
de saúde.
Every
Atualmente,
ministry
com esse novo
shows
desafio na área
what we have.
climática, também estamos
Right now, we have
trabalhando,
this big
né, com
challenge
vários
in climate areas. We're
dados
also working
governamentais sobre
with
clima, né,
several
de queimadas,
governmental sets of
desastres,
data on
temperatura, precipitação,
weather
poluição.
and
Então,
burning,
temos uma
disasters,
riqueza de dados.
temperature,
Então, como é que nós
contamination.
trabalhamos
And
com
so we
esses
have
dados, né? Os
richness of
palestrantes
data.
anteriores falaram muito sobre
We
como
know
utilizar
that
esses
we
dados,
can
como
work with
trabalhar com
that
esses
when
dados,
our other
armazenar,
speakers have talked about on how to
processar esses
use
dados. Então, o
data
SIDAX, ele pega essa
and how to
quantidade de
store them
dados, né,
and how to process
negocia
them.
esses
So
dados
SIDAX
junto aos proprietários de dados, e
takes
aí
all
nós trabalhamos,
those
como trabalhamos com dados
to
vinculados, nós
negotiate with
negociamos
data
a
owners,
disponibilidade dos dados identificados,
and we
né, com
negotiate
esses
data
proprietários
availability
governamentais para
as they have
trabalhar
been
com
identified
a
with that
vinculação dos
governmental
dados.
sets of
E aí
owners.
pegamos, então,
So we can
fazemos essa
work
negociação.
with
Isso é um grande
the
desafio,
linkage of
porque
that
para
data.
cada
So we
sistema de
negotiate
informação
that. And
e
it's a
para
big
cada
challenge
atualização
because for
desses dados,
every
precisamos
information
fazer uma
system and for
negociação para obter
every
esses
updating of
dados,
data,
né? Muita
we
gente
have
também
to go into
colocou aqui
negotiation to be
na
able to
palestra
obtain
anterior
that data.
quanto essa oportunidade,
A
né,
lot of people, as has been said
em tempo
earlier,
real para a entrega
talk
desses dados
about
nem
how
sempre
their
é
opportunity
atendida,
has
então
been
temos dificuldades de obter
in
esses
the
dados,
real
mas
time
nós
for
criamos uma
the delivery
plataforma
of
de
that data.
dados
So
que
we do
segue
face a
todo o
lot of
ciclo
challenges to obtain
de
that data,
vida dos
but we
dados, onde
created
essa
a platform
plataforma nós
that
recebemos
follows
esses
the
dados
whole
identificados,
life cycle of
solicitamos,
data with
recebemos,
that platform.
checamos
So
esses
we
dados,
receive it,
verificamos se
we
eles estão
request that
íntegros,
data, we
verificamos a
receive it,
qualidade
we
deles, criamos seus
revise them, we
metadados,
validate that
que é
they
baseado
are good
no seu
quality. We create
dicionário,
a metadata,
na
which
descritiva
is
desses
based
dados, na
on
proveniência desses dados,
the
colocamos esses dados numa
description
ferramenta de
and
metadados
the
para deixar
and,
isso público,
a directory
e
that
a
tells us
partir
where
de
they
toda
come
essa
from.
checagem, passamos
We
por
create an open public
uma área
platform,
que
and
chama,
after
que
all
aqui a
that
gente chama de
revision,
produção de
we go into
dados,
an
aonde
area
vão ser
that
os
here we
dados,
call
então,
data production,
pré-processados,
where
principalmente
they're
para a
going
vinculação,
to be able to process that
trabalhados
data,
para
particularly for their
atendendo aos
input
requisitos do nosso algoritmo de
to
vinculação, que é
respond to that
trabalhando
requirement
principalmente
into
nome da
our
mãe, data de nascimento, né,
algorithm.
e
We
município de
have mother's
residência, e
name,
trabalhamos então com a
date of birth,
vinculação. Após a vinculação do dado,
address.
esse dado nós
So
temos
we work
então
with bringing this data, and
vinculação
after that,
de um
adding of that data,
de uma base de dados ampla, né? Que tem
we
todos os
work
dados
into a
demográficos da maioria
wider
da população
database that shows all the demographics of most population, the most vulnerable population that makes more than 3 minimum wages that we call single registration, so that the government can build the sets of epidemiological quotas. And so we have the cohort of citizenship and the cohort of age. And we do it because it allows us to work together in a logic planning manner for public health. So at the very moment when the individual goes into that cohort, I can follow up and to see what happens to that individual from the moment that individual went into the cohort. So that's when we tell the researchers. And so from the research objectives, they work together with a request of that data, together with the purging of data. And that data is available to what we call the following layer. And the controlled environment. So I'll tell you a little bit later how is it that we worked with that request to be able to work with the study that they had and to be able to respond to that. We had to see what was the structure of those cohorts, always to reinforce the cohort of 100 million Brazilians. So we took that database that comes from the single record for the program of the federal government, which contains basically all the information pertaining the Brazilian population that was registered in the system for them to be eligible for social programs and that have an income less than 3 minimum wages per capita. So to this study population that we worked with, and we worked with considering them in all the social programs, My House, My Life, Work for My Family, programs that are very easy to enroll into because there is a single social identification number that is going to link them with that population that comes from the single registration. So we're able to achieve a quick registration. We called it the precise determinant registration for hospitalization, identification of diseases, monitoring of growth and development. And so we don't have that single registration number for many programs. So we have that algorithm and we had to create it to see what was the characteristic of those 100 million of individuals. And so therefore they go into the cohort of 100 million Brazilians. And it is established from the first registration of that individual and the family that was enrolled in the single registration, that family member. So most in the registration of that cohort are young people and women. And we also have the birth cohort, which is the one that comes precisely from the moment of enrollment into that baseline of the 100 million Brazilians cohort, which is a population that comes from that national system of single registration. In the past, with the population of live births. And so that new population becomes the population from 2001 to 2018. So right now we have almost 30 million of live births registered in that cohort between 2001 and 2018. Most of them are young people. It's a young population above 8 years old and that were vaginal births. So the way we link that is we process those algorithms and from the enrollment into all the registration system. So I take the baseline of the 100 million Brazilians cohort linked to the live births in the national system, just as I said, with an algorithm we call CDAX, CRL, which is an algorithm that works as a linkage, if we can call it that way, taking in consideration 5 features: the name of the mother, date of birth, address, state of residence, and gender. And we then measure
nós temos uma alta
the
acurácia
precision in
dos
the result
sistemas
of
dessas
that
vinculações,
registration. We have a
a
high
coorte com
accuracy in the
nascimento, a
systems
coorte com mortalidade, a coorte
with
com
those
monitoramento de crescimento e
enrollments, the
desenvolvimento,
birth
geram
cohort,
mais de 90 a
mortality,
95%
the
de acurácia
monitoring,
da vinculação
which
desses
generates
dados.
more than
E claro, para
90%
isso,
of
como
the
também
accuracy
quem me
and
antecedeu
the
colocou
registration
o
of that
quanto é
data. And
importante ter
of
recursos
course,
computacionais, né, para
and as the
trabalhar
person
com
before me said
essa
it is very
vinculação
important to have
e
these
esse processamento
resources
de grande
to be
volume
able
de
to
dados,
work with
né, de
that
140
registration in
milhões,
that
50
process of the
milhões,
large
30
volume of
milhões,
data,
então
140,
precisamos ter
150,
recursos
30 million. So we
computacionais
need
e
to
a
have,
gente tem aqui já tínhamos anteriormente recursos computacionais de alto
so we
desempenho
didn't have
e que
those
atualmente a gente
resources
comprou
first,
esse
and now we were
container
able to
para
put together the high
agilizar o
performance
processamento desses dados.
computer
Nosso ambiente
resources, and
de
we bought
computacional é
that
dividido em dois, um
storage
ambiente que é a
for
sala
data.
segura, porque
And in
para
the
poder
environments, they
atender
split
aos
into two.
regulamentos, aos
The
marcos
safe room
regulatórios de
to be
segurança e
able to
privacidade,
respond to the
trabalhando com dados
regulations and
identificados,
the
precisamos seguir a
legislation in terms
legislação do
of
Brasil
capability,
com relação à
working
segurança e
with
privacidade,
capable
e, portanto,
data.
nós temos uma
And
sala
we need to
segura
abide
que é
the
todo
Brazilian legislation in
segue os
privacy and
protocolos,
safety. So we
né,
have
de não ter
a
acesso à
safe room that
internet, de ter
follows the
acesso
protocols.
privilegiado de pessoas que são autorizadas para fazer o processamento de dados.
And so to also
Existe
provide access to those
pessoas
that are
responsáveis pela
allowed
segurança
for
da
data
informação que
processing.
recebem esse dado
And there are
identificado,
those
que
in
transportam esse
charge of
dado, que
information
checam esse dado
security
e que então
who
disponibilizam esses dados para a
transfer
sala
that
segura.
data,
Dentro da
check
sala
that
segura
data,
não tem
and make that
internet,
data
e ele é
available to
monitorado
the
24
safe
horas, né?
room. In the
E o dado
safe
de lá só
room,
sai
there's no
através desse
internet,
responsável pela segurança da informação
and that data
para um
only comes
ambiente, outro ambiente, que
from
é o
that
ambiente de
person in
análise,
charge of
que são os
information security
datasets
to another
extraídos
setting,
dessas
which is
coortes, né,
analysis,
a partir para
which are the
responder
data
pedidos
sets
de
extracted
pesquisa,
from
a
those
partir da
cohorts
solicitação dos
to
pesquisadores.
respond
Então,
to
é um ambiente de
elements of
análise que também é
research
bloqueado da
from
internet, ninguém pode
the
fazer
action of
download
the
dos
researchers.
dados,
It is
e
an
esses dados,
analysis
então, esses
environment
datasets são
that would
disponibilizados
be
e os
blocked by the
pesquisadores
internet if
acessam
that
através
data
de
say
uma máquina virtual e
is
não
available
podem, só podem ter acesso aos resultados.
and is done
Então,
via a virtual
nós
machine, and
temos
they can
acesso a
only
esses
have
dados
access to those results in that
das
way.
coortes.
So we have
Publicamente, nós
access
temos
to
duas
that
formas.
data
Uma através dos metadados, como a gente comentou, e pode ser acessível
available
pela
in the cohorts,
ferramenta
one of them through
Dataverse,
the
que
metadata,
pode
as I
ser
told you, and it can be
acessível nesse
done
link,
through the Dataverse,
dataverse.sidax.org, e através
Dataverse,
de aplicativos de
which
visualização
can
que se
be obtained in
encontram
this
no site
link.
do SIDAX também, aqui
And
pelos
through the
aplicativos.
application of
E
that,
para
it is also
obter
found in the
o
application and
dado
the
para fazer a
websites,
análise
and to be
da
able to
coorte de 100
obtain the
milhões de
data
brasileiros
for
vinculada,
the
né,
analysis of that 100
a
million
responder
Brazilians cohort that
perguntas
is
específicas,
registered to
aí
be
tem
able to
todo um guia
respond
de
to the
acesso,
specific
que precisa ter
questions.
uma parceria com o SIDAX,
There
que
you
precisa
have
ter
a
um
whole
projeto de
access
estudo
guideline that needs to be
financiado,
linked to
com
SIDAX.
parecer ético, né, e que
It needs
possa
to
estar
have a finance
de acordo
study
com a agenda
to be able
estratégica do
to reach
SIDAX.
to that
Então,
place,
quais são as evidências que temos
to be
produzidas
together
com
with the
esses
SIDAX
dados? Né? Nós
strategy.
temos eu
So
vou só
what
apresentar
strategies have we
alguma. Nós
gone
temos mais de
with?
200 artigos publicados,
I'm just going to
né?
talk
E
about
aqui no
some of them. We
SIDAX,
have more
dentre
than
eles, em
200
torno de
papers published,
60 a
and here in
70 artigos
SIDAX,
publicados com a
between
coorte de
them,
100
we have
milhões de
60 or
brasileiros.
70
Então,
papers that have been
vou trazer
published with
aqui
a cohort of
principalmente
100,000
as
of the 100 million
desigualdades
Brazilians. And
sociais, né,
here,
relacionadas
I'm going
ao
to address
crescimento no
mostly
Brasil.
social
É um artigo
inequality
publicado
related
utilizando
to
4 milhões de
growth in
pessoas,
Brazil.
de crianças que
It is a
foram
paper
analisadas, segundo
that we
raça,
worked with
cor, e a gente
using
pode
4
ver que, por
million
exemplo, as
people,
crianças
children.
indígenas,
The
elas
second
sempre
is
pesaram
race,
em
and
média menos gramas do que as
and
crianças
we can see
brancas,
that the
e também
indigenous
cresceram
children
em média
were
3,3
always
centímetros menos
lowering
que as
weight than
crianças
the
brancas,
white children
tendo
that
principalmente
were also
doenças
behind in
mais
3
relacionadas à
centimeters
pobreza
height than white children.
e
We also have diseases that are
situações de
more related
maior
to poverty
vulnerabilidade, como
and to
desnutrição e atraso de
situations of more
crescimento,
vulnerability,
e
such as malnutrition and delaying growth.
doenças relacionadas a baixo peso e
So
deficiência de
this is
crescimento.
related
Em relação à
to
mortalidade
low weight
infantil, o que
and
a gente
efficiency in
percebe é
growth.
que crianças que
And
nasceram de
obviously
mães
everything that
indígenas
has to
tiveram
do
cerca de
with child mortality,
98% mais
children's
chances de morrer
the children sorry
nos primeiros
that were
5
born
anos de
from
vida do que as mães
1998
brancas,
has many
e
more chances to
possível
disease
verificar, e
or
essa
to pass
linha
away
é
in the
mais
first five
clara, né?
years.
Azul clara é de
And
crianças
and it's the
indígenas,
clear
né,
blue
que
line.
morreram
Um, obviously,
com doenças de maior
mm,
relacionadas à pobreza, como
with
a
a
desnutrição e diarreia.
greater
Também, se a gente
diseases
for para
that can be
doenças
related to
que estão
poverty,
relacionadas com a
as
pobreza, como a
lack of
sífilis
nutrition,
gestacional e
malnutrition, and
congênita,
diarrhea.
a gente verifica que, estudando mais de 15 milhões de registros de nascidos vivos, houve um risco
Also,
maior de sífilis
diseases and
gestacional e congênita
syphilis,
em
that's
mulheres pretas e
congenital.
pardas, e se todas tivessem os
There's a
mesmos
high risk,
condições de
obviously,
vida,
from
nós
the
poderíamos
diseases
evitar no
that can be
Brasil cerca
seasonal.
de 40%
Um,
de
um,
sífilis gestacional e
mm,
45% de
mm,
sífilis congênita.
and
Né? Quanto a evidências
mm,
em impacto do programa Bolsa Família,
obviously,
o que a gente
48%
pode
percent
ver
of
é
syphilis,
que
congenital
houve,
syphilis.
para os beneficiários do
So,
programa Bolsa
what we can
Família, uma
see
redução de
here is that
17% na mortalidade
for the
infantil,
beneficiaries
18%
of
na
this
mortalidade
program,
materna,
there was a reduction
30%
of
na
17%
prematuridade,
in child
11% no
mortality,
baixo peso ao nascer,
18% in mother's
14% na incidência de
mortality,
hanseníase
30%
e
of
26%
premature
na cura,
mortality,
42%
11%
na
in low
incidência de
weight
HIV
at the
AIDS
time of being
e 25%
born,
na
14%
letalidade,
of
44% na
incidence
mortalidade prematura e
of
56% na
in
mortalidade
less
por suicídio.
HIV,
Quando a gente trabalha com o uso de dados
and
climáticos vinculados
56,
à corte, aí a gente não
26%
tem ainda
mortality as
estudos
a cause of suicide.
resultados publicados, porque esse é um
Um,
projeto que temos apenas um ano
there
e
are no
meio
studies
trabalhando.
that
Nós
are
temos
not
14
published
estudos
because
já
it's a project that
vinculados
is just
para
ongoing. It's not ready
fazer a
yet.
análise desses efeitos climáticos com
So we
dados da
have 14
corte,
studies that are
mas eu
part of this
trouxe aqui
to
dois
do the analysis
estudos,
of
um
these
deles, efeitos
issues.
da seca nos desfechos de
Um,
nascimento, um estudo que é
mm,
da
mm,
plataforma
mm,
Clima,
mm.
utilizando mais de
Obviously,
25
the results
milhões
of
de
drugs,
nascidos vivos, né, entre 2000
obviously
a
a platform
2020, é possível verificar o
climate,
efeito da seca sobre a
and
prematuridade,
obviously
que foi
this
mais
number that
pronunciado nos
so
biomas,
between
que a gente tem vários
2009 and
biomas no Brasil,
2020, we can
né,
see the
e
influence of
principalmente na
drugs,
Amazônia, e na Caatinga,
especially
e
in
na região
different
de
biomes in
Norte-Nordeste, que
Brazil,
são
biomes
as
in Brazil.
regiões mais pobres do Brasil.
Um,
Também, quando se pensa em avaliar os
obviously,
programas de 1
um,
milhão de cisterna, que está muito
mm,
relacionado com o
um,
ambiente,
mm,
sobre a mortalidade
and
infantil numa
million
região de
systems,
muita seca, que é uma
mm,
região semiárida
mortality,
de baixa renda no
um,
Brasil, que ocupa
and
15% do território
drugs,
nacional e tem mais de
and
38
low
milhões de
income in
pessoas
Brazil.
morando nela, nós podemos
Obviously has
verificar
more than
que,
31 million people
utilizando
living
dados, né, de
uh,
crianças que receberam
using information
cisternas, né, que são aquelas soluções que
that
provêm água para os
receive them in
domicílios,
those
aonde não tem, a população não
water
tem acesso à água.
tanks, water
Quando eles
trucks.
recebem essas cisternas antes do nascimento,
When they receive these
houveram
trucks,
uma proteção, né,
mm,
dessas crianças para
um,
mortalidade em menores de 5 anos, para em torno de
mortality
30
for
a
this
35%.
people
E
that
aí,
are
quando a
or
gente
children
avalia
that are 5 years and less, still 35%. And
a
when they
relação
assess
do
that
efeito dos programas de 1
relationship
milhão de cisternas
the
com o tipo
effect
de doença,
of
a
a
gente vê que
million
são as doenças
water trucks
infecciosas e
program
parasitárias que tiveram maior
or water
impacto, em torno
tanks,
de
we see it's not water trucks, actually, it's water tanks.
57% de
In
proteção, né,
regards to
contra
57%
as doenças
protection.
infecciosas parasitárias
Um,
e principalmente em
mm,
relação à diarreia, doença
mm,
nutricional e má
mm,
nutrição. Né? Então,
mm.
essas são as
Um,
evidências que nós utilizamos
and nutritional disease.
quando utilizamos as
So
coortes
those are the evidence
epidemiológicas
that
do
we use
SIDAX, e isso só
when we
foi
use
possível
the
fazer todas essas
cohorts in
análises por
CDAX. And
conta da
that was possible
magnitude do número,
to do this
para que a
analysis
gente pudesse
because of the
analisar
magnitude of
população
the
por essa
number
cor, a população
mm,
em
for the
grupos mais
population, for
vulnerabilizados,
the
né? E
population in
também
groups
de a
that are more
magnitude do
vulnerable,
evento, por exemplo, para estudar a
and obviously
prematuridade,
the
para estudar a
magnitude of the
malnutrição.
event,
Um outro
everything that has to
uso
do
dos dados
with
no Brasil que
prematurity
nós fazemos
and
a governança de
malnutrition.
dados é
Another
quando
use
nós
of
trabalhamos
data
com
in
os dados
Brazil that is used
desidentificados,
in
ou seja,
governance
são aqueles dados
was
que
when we
estão
work
públicos,
with
os governos
de-identified
disponibilizam publicamente nos
information.
seus vários sites,
So
né,
it's data
disponibilizam
that
para
information
uso
have
público. E
available
nós fizemos,
in
então,
these
uma
web
coleta
platforms
que
and put it at the
organizamos e
disposal
trabalhamos com a
for public
governança,
use.
fazendo coleta, captação desses dados em
So
todos os sites,
we organized
trabalhando
together
com
with the government.
uniformização e
We did do a
padronização da coleta
collection
desses dados, que são
of
dados
data
demográficos, socioeconômicos, climáticos,
with
ambientais, de
registration,
serviços de saúde, de eventos de
standardization, and
saúde
economic
nessa
demographic
plataforma, num
data,
só lugar, que é a plataforma
healthcare
de dados
services. All of
desidentificados,
that is
PDD
part of this
SIDAX.
platform,
Então, a gente tem
which is
37
the
fontes de
platform
dados,
of the de-identified
178
data.
datasets, mais
So
de
we
2.167
have
tabelas e quase 2
more
terabytes
than
de dados, né,
2,077 datasets.
ocultados nessa plataforma, que utiliza
Mm,
a cloud da Google para
mm,
poder
mm,
analisar
that use the cloud, iCloud, Google Cloud, and iCloud to analyze the data, to access the data. So you go into the platform, you see what is the data available, you choose it, and through an application that we're seeing here, we can select the information. So we use information, etc., etc. There is data, that we climate data that is being worked, and use that governance of climate change to be able, or climate data to be able to put it at the availability of researchers. How can we use that platform, which is the platform identification that was quite useful during the pandemic? And the data to work with the data of what happened, what used to be happening during the pandemic. So we also created the indicators of social equality for COVID-19 and the Brazilian Index for Healthcare Promotion. So that's all part of the platform, and we are working with the magnitude of social elements, which was the estimate that we're doing with the official data that correspond to the magnitude, the real magnitude of the events that are part of the figures of diseases through the platform of this data. And we also work with inequalities and mainly with data to assess the public policy effectively by using data for psychological studies. Also, we had monitoring plans. Actually, we visited real life panels during COVID. And obviously, the person that talked before me talked about the need of transfer of knowledge and talk to society so we can explain to society what is the use that we're giving to the value of this data and how we're using the data of these people that we call here populational data, or the CDAX, for research and health. So we do basically a series of conversations, dialogues with our representatives, all the different stakeholder groups or civil society organizations and researchers as well, and different academies to be able to explain to them what we're doing in the way that people can know what we're working on and the data that we're producing. That was it. Thank you.
Muchísimas gracias.
Thank you very
Judy,
much,
esta
Maria Judy,
reveladora
for this insightful presentation.
Agradecemos mucho
We really would like to thank you,
Lamentablemente nos hemos
both panelists. Unfortunately, we have gone way over the time. We're not going to have any time to answer your questions. It's actually really important to thank you, to thank more than 300 people in this webinar. It's for us. We're really proud to be able to have this opportunity of training you and show you what's going on currently in all these issues of digital health. So, without further ado, I'm going to quickly close this webinar and tell you the next week you have another activity about the civil registration systems and digital statistics. So we hope to see you there. We would like to thank all the team that joined us here from the Information Systems Unit to the interpreters, those of you, and to Carlene and Bariashuni. We hope to keep counting on you and to all these events. So thank you for participating. To my colleague Andrea Gerner, she's here with us too. Thank you for coordinating all of this section. So without further ado, we'll say goodbye to you and we'll see you next week. Thank you.